My name's Mary Effler. I was actually on the committee, and we chose Welcome House as a finalist, and was very excited to see them be a winner or a recipient. Sorry. Anyway, I don't know that I can say when the first time that I realized or thought about homelessness, but if anyone's interested in doing anything for people in the Cincinnati area, I am very active with St. Francis Ministries, and 3 days a week serve dinner to them. Right now we're doing like carry out dinners where people come up to a window, but we're always looking for volunteers. It's a very simple, short thing to do. And they are a previous recipient of an impact grant, actually for the kitchen that we use to make the food. But I kind of have a funny story about homelessness. We took our kids when we lived in Detroit to a soup kitchen to work one time, just to volunteer. And we got there and there were a bunch of people standing outside the front of the building, and we went in and we served them, and we were leaving there, and we're driving down the street, and there were people. We were on 5 Mile or some big street, and there were people on the side of the road waiting for the bus, and my kids started going, "There's a homeless person. There's a homeless person." And I said, "Wait a minute, you guys, let's talk about this." It's like, just because someone's standing out on the street corner doesn't mean that they're homeless. But it was kind of funny, like, we lived in the suburbs and they obviously had no experience with that. And so it was a very teachable moment, and was an eye-opening to me to realize that we have to take every opportunity to talk about it, and to our kids, especially. Now they're all grown and it's all good. Anyway, that's my part.
Thanks, Mary. Would anyone else like to share?
I'll actually piggyback on Mary. I'm Sarah Grace. I'm president of Impact 100, and I think the first time I remember learning about homelessness was seeing someone, with a sign on this, like on the highway or on the highway exit or on ramp. And I don't think I assumed that everybody was then homeless that I saw there, but I remember that was my first having it in my consciousness. And then I remember, downtown Cincinnati at the time was the suburban flight had happened, and like we would go down for Christmas and stuff, but you would see, I remember seeing like the sleeping areas and like the door, and like the entryways and things like that. And just I don't really remember what I felt. I just remember not really understanding how that could happen, and like thinking about how, like, I think I probably was like, where are their mommies, right? Like, where are these people's families? So, memory.
Thank you, Sarah Grace. It looks like we have a few people who are either calling in or on their phones with their videos off, which is totally fine. When they start presenting, I'm going to eat lunch too, and would probably turn my video off for a minute, but would anyone else like to go? Otherwise, we're going to turn it over to Sarah Grace so she can introduce. But Justin, I just saw you take it off mute.
Yeah, I can go. I don't know. I don't know if I'm supposed to or not. I already forgot what I was supposed to say, though. I'm Justin. I work at Welcome House, so I went through the whole impact process. I loved it. That's how I know impact. My first memory of homelessness, I had a lot of family members that had like addiction issues and domestic violence. And so we at different times had different family members that would sleep on our couch or stay with us for long periods of time. So I remember from a pretty young age.
Thank you so much for sharing that. So one of the things, if those of you who know me professionally, I spent the last 8 years before my current work educating a lot around poverty and homelessness. And one of the statistics that always struck me was that 40% of Americans are just a paycheck away from homelessness. And that always really kind of slapped me upside the head and made me realize, wow, that's almost half. And when you really think of that and the work that Welcome House is able to do for our neighbors experiencing homelessness, it's so amazingly critical. And we're grateful that you're all here with us today, wherever you're calling in from, to learn about this, the plight of homelessness and what Welcome House is doing. So Barb, correct me if I'm wrong. Am I supposed to turn it over to someone now?
Just turn it over to Sarah Grace.
Sarah Grace.
Yeah.
Thank you. Thanks, guys.
Okay, thank you everybody. I apologize. My internet went out at my house, so I'm trying to like wing this on my cell phone. So we usually have a pretty PowerPoint, and we don't have that, and we usually are on Facebook Live, and we don't have that, but at least we're recording. So I'm Sarah Grace. I am president of Impact 100 this year, and I get the privilege of just telling you a little bit about who we are and what we do. Impact 100 is an all-women collective giving organization, and our mission is to empower women to dramatically improve lives by collectively funding significant grants that make a lasting impact in our community. How that works, how we fulfill our mission is women join either a $500 or $1,000 level. Then we pool those monies into grants of at least $100,000. Local nonprofits are then asked to submit a grant application within one of our 5 focus areas, which are family, health and wellness, education, culture, and then environment, recreation, and preservation. So a pretty broad range. Our members then come together and review the grant applications, perform site visits and financial analysis, and then ultimately they are the ones who select the grant finalists. And then in September, at our annual award celebration, the finalists present their transformational project, and then we vote live on who will receive the grants. And then we have a fairly long-term grant partnership where we partner with our grant recipients between 1 and 3 years to help them ensure that their transformational projects gets off the ground. Since our inception in 2001, we've awarded over $5 million to local nonprofits for a total of 47 transformational projects. And this year, we have 541 members, and we have a grant pool of 468,000, which we actually took the 68,000 and donated it this year to the regional response, the COVID-19 regional response fund activated by Greater Cincinnati Foundation and United Way. So we have 4 grants of $100,000 this year. I like to share a little bit about what makes us special. So first is that 100% of your membership dollars go to the grant pool. So 100% of the money you give Impact 100 as a member goes right back into the community. 2, our members can be as involved or uninvolved as they'd like to be. It's a build your own adventure membership. So you can just write your check and know that the other 540 members are going to be really great stewards of your money, or you can be president. I mean, it runs the gamut, right? So there's lots of entry points for participation. And then lastly, what I think is just like incredible is we have no paid staff. So we have 100% working board, 24 members plus a part-time administrator, outsourced administrator who we could not do it without. But it's these 24 women and Jen, our admin, just like making it happen with our committees and the power of the collective behind us, which is incredible to watch, I will tell you. And because we start the year with 0 operating dollars, but we still have not 0 expenses, we have sponsors. And usually this is when I would flash our really pretty PowerPoint slide that had all of our sponsors in a row, but I don't have that right now. So what I would love for you to do is to take a minute and just go to our website and look at our sponsors for this year. There are some great companies on there that help us achieve our mission and do what we do every day. And with that, it is my pleasure to then pass this over to the real stars of today, which are our 2 team members from Welcome House. We have Morgan, who is the Street Outreach RN, which I think just sounds like the most badass title ever. And then we have Justin, the Director of Program Operations. And so I am going to zip it and let them talk.
And my title isn't badass at all. Thanks for pointing that out. I've been trying to change it to Director of Awesome for a long time, but they won't let me. But I'm still going to keep trying. So yeah, thanks for having us. We're real excited to be a part of this. Morgan will give a lot of the details and everything because she's really the one that runs the RV. This is probably the first time I've been on it in several months, but it looks great, Morgan. Good job. So yeah, we were awarded the Impact Grant almost 2 years ago. 2 years ago in like December, I think it was, or was it November that we got the check, something like that. So we officially launched our mobile unit last August. It started getting on the road last July. So it's actually almost been a year that we've been out and about, which is crazy to think about. When we initially applied for the project, we thought it'd be really great if we could serve 200 to 300 people a year on the RV. We thought that would be a really good impact. Right before COVID hit, we were serving 200 to 300 people a month. So that's crazy. So we've really seen our impact and what the RV can do grow exponentially in just a year. One of the big goals for us was to expand our reach with the mobile unit, because we are based in Covington. We served mostly people in Covington, but now we've really expanded to all 8 northern Kentucky counties. So we're regularly going to Grant County, Carroll County, Pendleton County, lots of other counties I can never remember the names of. But we've really been able to connect with a lot of people that were homeless, specifically in Grant and Carroll County, which I wouldn't have really known they were there, but there's a lot of them. So it's really been able to allow us to load up the RV and go and serve those people where they are, which is really cool. So we're really excited about that. Morgan's done a great job. We've been doing a lot of HIV and hepatitis testing on the RV. We offered free flu shots last year, which we're going to do again. We've done a ton of different education events. Yeah, a lot of cool medical stuff. So I guess I'll let Morgan talk for a little bit about the medical side of it.
Yeah, hi everybody. So like Justin said, we've done a lot of educational stuff. We've done screenings. We during the COVID-19 thing, we made sure to do a lot of education in the community about how to keep yourself and others safe. We've been passing out a lot of hand sanitizer and a lot of necessities as important resources around the Cincinnati area have closed. We have stayed open, and we've continued to perform this mission and make sure that people are getting what they need. We visit every single county at least once a month. 3 of the counties we visit every single week. And those, Kenton, Campbell, and Boone are the ones that we see the most people in and that we visit weekly. But like Justin said, Grant and Carrollton are becoming counties that we might start visiting multiple times a month. We have partnered with little shelters in those areas, in those counties, that as we've been down there building relationships with the locals, we've met people that are starting their own little shelters and church basements. And now we have kind of satellite partnerships in all these different places. And we're getting our reach out so much farther because we have locals spreading the word. And that's been awesome. I've been collecting data on just different public health issues, what people in different areas are, what medical problems people have, demographics, like age, race, sex. And so I think we're going to find a lot of interesting research about what diseases are affecting what population. And I have a nurse practitioner working with me who's been allowing me to give over-the-counter medications and who has been doing specialty visits with clients who are overly mistrustful or very mistrustful of the system or of specific doctors. She'll see them in person and she will help care for them. And then we have partnerships with places like St. Elizabeth and their public health specialists and their environmental health specialists. And we're helping to kind of make sure that, Justin, how would you explain that? Like we're using those partnerships to help be stewards of people's public health and safety in the community and make sure that people understand their own hygiene and that people are taking care of themselves. People have access to cleaning supplies. And help me out, Justin.
Yeah, we've never intended to be anybody's primary care physician and ultimately like take care of everything. So it's really important for us to partner with those places So one of the really cool things that Morgan does is we have the health insurance assisters that'll come out with us as well on the RV. So we can immediately get people signed up for insurance and then immediately get them connected like same day or next day with specialists or a primary care physician that's right where they're at. So we've built those relationships really well because our population that we're serving is so vulnerable to everything. I mean, COVID especially too, but even before that. So we've worked really hard to make sure that they're connected to those resources and they have insurance so they can get the service that they need.
And Justin, that's a really good point, because the average lifespan of anyone who's experienced homelessness in their lifetime in the United States is 50 years of age. So what we found a lot of is that people either don't understand how important primary health care is, or they don't know when they're supposed to be getting checkups for certain things. You know, they don't know that they're supposed to get a colonoscopy at 50 years of age, or they don't know that they're supposed to be getting mammograms at 40, stuff like that. And so everyone that comes into the RV, I kind of screen and I figure out what their age is and what they have been doing for their health and what they should be doing to continue to take care of their health. And I really teach people to be advocates for their own health. That's the biggest mission here. And hopefully we will, in the next 10 years, see that translate into increased lifespans for the people in our community.
Yeah, and we, Morgan has done a lot of different educational classes around sex education, dental hygiene. That's one of the big issues that we've seen. Healthy eating. We're trying to really target our education around what our people need. And even during COVID, Morgan has worked with our volunteer medical director. We've probably tested, a few hundred people, Morgan, for COVID.
Yeah, let's see. So far, I think we've done like 150 tests so far.
And we've had 10 positives-ish?
Roughly, yeah.
Justin and Morgan, I'm curious, when you say that you do educational efforts, logistically, what does that look like? Meaning one-to-one, one-to-many, you convene people at a park? I'm just curious what that looks like, since it's such a transient population.
Yeah, that's a great question. We try to do them regularly at the library that we're at, and then we try to utilize the library facilities. So we might use like a conference room or something. And then we really try to incentivize people to come by kind of giving them something if they come and sit through the class, or offering them food. So we do them in like a class type setting, but Morgan also does them all one-on-one with everybody that she talks to. And then I think in Grant County, you've done a few just out in parking lots, right, Morgan?
Yeah, I've done pretty much anything everywhere. If I have the opportunity to tell somebody just a little gem about their health, I will. And then especially when we were in the hotel during our COVID response, we housed some of the more vulnerable populations in hotels to help them quarantine. I talked to every single person, and I did a health screening, and then we talked about, what they should be doing to safeguard their health, whether or not they needed to go to specialists and whatnot. And every single person got a talk about dental hygiene and why it was important. And it was pretty amazing, because I think out of the 60 some odd people that I had this talk with, one person knew the answer to, besides, cleaning your teeth, why is it important to go to the dentist every year? And only one person knew an answer to that, other than, just to keep your teeth clean, which is pretty amazing.
Will you share the answer? I don't think I know what the answer is.
Yeah. So one of the things that I would like to highlight about dental health is that your gums are kind of a direct access point to your bloodstream. So if you have a ton of germs just kind of hiding up in your gums, and you get an infection in your gums, it can very easily spread to your blood, and then from there to the lining of your heart, both of which are ICU stays. So pretty serious medical conditions. Obviously, I say that to just to be careful and kind of scare people a little bit, because it doesn't happen to everyone, but it is important enough that that's something that dentists look for every year. They look for oral cancers in your mouth. You know, I could actually look at the back of someone's mouth and tell you if you have a liver problem. Like, there's a lot of random stuff that you can tell about a person's health from their mouth. It's really pretty crazy.
So I just wanted to hop in real quick and say, if there are questions at all, feel free to chat them. There's a button at the bottom of your Zoom call where you could chat to the whole group or chat to me if you're not comfortable, or even unmute yourself to ask Morgan or Justin any questions. I have a question and maybe a statement. So I'll start with the statement. In 2018, when Welcome House was awarded the grant, I recall that most of your outreach efforts to people who were living under overpasses or outside or choosing to not come into the shelter were done on foot. I'm wondering if you could speak at all, and I don't know if either of you have that historical reference point, to be able to speak to how you can touch more people and just the experience juxtaposed against walking on foot to serve people and the dignified experience that you can now provide in the van that Justin is sitting in.
Yes, great question. We often call that a kind of a search and rescue mission, where we are hiking around just looking for people, and we still do that. That's still an integral part of what we do. But we're really able to maximize our efforts by putting the RV at a location where people congregate, such as libraries or parks, and letting people kind of come to it. So we can really focus our efforts and not spend time walking around, hiking, just looking for people. That's still an important part of what we do, because we want to make sure we're touching everyone. But the RV allows us really focused time where people know where we're going to be every week. They can expect us to be there. A lot of our people don't have access to like mail. So they know, hey, every Monday I can come, and if I have mail, the RV is going to bring me mail. So different like that, where it's providing stability for people. And then really with the dignity, when we're out on riverbanks and serving people, we're in their homes, which is really odd if you think about it. Like, we're walking up on you sleeping often. And I don't like that. Like, I don't like when my kids walk in on me sleeping. It just is uncomfortable. So when we're coming into somebody's house and we're asking them questions, trying to help them, it's a really weird dynamic. So for us to bring them into this beautiful RV and really make them comfortable, like, this is the couch they do interviews on, and we kind of sit in this desk, and they're able to really kind of relax and take it easy, and we've got coffee and food, and it really is a really dignified way for us to serve people, as opposed to just sitting on the ground with them.
Especially since the regularity of the RV in specific places, you know, a weekly visit to a library per se, allows for people to get to know us on their own terms. We had a gentleman who just in general was, he took like 5 months to even come up to the RV and get a snack from us. We would see him every Monday and we'd say, hi, how are you? You know, would you like something to drink? And he didn't want anything to do with us. And now, you know, every week he greets us by name. You know, we're very friendly. We've gotten to know each other very well. And that's allowed us to provide him a lot of help. And that's somebody that if we had just gone up to on the street, never would have let us help them. So
can I ask, do you post your schedule, what your route is? You know, like maybe at a library or at a, okay.
We have these little guys that we pass out that has, I don't know how well you can see that, but it has like our normal days at Boone, Kent, and Campbell County.
Okay.
And I don't think I have any. We have these giant posters that we post up in the libraries and different locations of where we're going to be. So yeah, that's one of the big things we've done is advertise. So, and then these little guys have like, this is from October, but it has what Morgan's like education events are going to be that week, and the topics and different things like that. So, well, that's upside down now. We've got these really nice dry erase posters that say exactly where we're going to be and when we're going to be. And then we've really expanded our outreach team since we got the RV too, and we've really delved more into peer support. So we've added a lot of members to our team. So while people are out on riverbanks and interacting with people too, we will tell them like, hey, come see us at the library. We're there every Monday. And then we also let all of our community partners know too. So if they know people, they can direct them to us.
Thank you, Barb, and thanks, Justin. Have there been any surprises, things you didn't anticipate when you originally came to Impact 100 for funding?
Oh gosh, I mean, I think everything. I think this was kind of a dream that we just thought would be really cool, and I don't think we ever really thought it would happen. And then for it to happen so quickly and for it to grow so quickly, and then for, Morgan has done such a great job building partnerships. I think that's been a really surprising thing too, is everywhere we kind of go and connect with, people are really excited about what we're doing. St. Elizabeth has been hard for us to partner with for years, but they just love this idea so much that we're really kind of building that relationship. And that's been really helpful. So I think it's just having this vehicle, everybody's like, kind of like, oh crap, they're legitimate. So I think it just adds like a kind of an air to, we have this really nice vehicle. People take us more seriously of what we're doing than walking around with a backpack, I think.
Morgan, I loved that you talked about that man who wouldn't come for 5 months, and it took some time and consistency and relationship building. And I think like we just as people are wired for stories. I wonder, recognizing HIPAA violation, if there's another story of a client that you feel like you could share with us that speaks to the services you've been able to provide that you wouldn't be able to if you were on foot.
Yeah, sure. There's so many. Let me try and just single out one. Oh gosh, Justin, any jewels coming to mind for you?
I'm thinking of so many too. I mean, I think some of the ones that pop out to me are, Morgan has experienced a lot of women that are in really precarious situations, which we see a lot with homelessness, that maybe we think they're being trafficked for drugs, or we've even had like some underage girls that have come on, and Morgan's been able to provide pregnancy tests, access to resources. I think us just having this vehicle has allowed people to kind of come to us in a different type of scenario. So I don't know, Morgan, I think a lot about that couple in Newport. I don't know if you can share more about that.
Oh yes, what a couple. They have been on the just outside for a while, and the young lady is being trafficked by her boyfriend, and it's very sad because when she first approached me, she very much she wanted to get clean. She told me she was pregnant and she really wanted to get clean so she could keep her baby, and she wanted to get out of this relationship. So I gave her some resources, and I actually spent the day with her and took her to an organization in Cincinnati called Women of Alabaster. I believe they actually applied for the Impact 100 grant the same year that we got it. But I know the founder of that organization very well because I previously did a lot of volunteer work with her. So everyone that I meet that's in a sex trafficking situation gets referred to her, and she takes very good care of them. But that was just a very interesting scenario, and it turned out that unfortunately she wasn't ready, and she went back to him, which happens. We can try as many times as a person will let us, but then as soon as they're not ready, we can't make somebody be ready to go into recovery. Only they can, but we'll be there whenever people are ready. And it's just a very sad story. Is that the couple you were talking about, Justin?
Yeah.
Okay.
Yeah, I think one of the other really good examples is this guy Dana. And Dana has been homeless in Boone County for around 10 years, Morgan, is that right? It's a long time.
Yeah, something like that.
Somewhere around 10 years. And he was one of the first people when we went to Boone County in the RV that we would see. And he was pretty reluctant to come up to us, but like we started giving him free pizza. So then he would come. That
Pizza is
worked
his
pretty well.
jam.
Yeah, pizza. He really likes pizza.
Every week he asks me if we have pizza.
Yeah. But still, every week we would come and he would talk and he would be really nice, but he wouldn't want any help. Like we would offer to connect him to housing and all kinds of stuff. And he just didn't want any help. And that was fine with us. And we were happy to kind of chat with him. But he's become like our biggest advocate in Boone County. Like he will encounter anyone that's homeless and he'll be like, hey, this RV comes and they're going to help you. And, you really need to connect with them. And like then he comes and tells us about these people. And he's just been this great thing of if we never had the RV, I don't think we ever would have connected with him. And then he wouldn't have been able to connect all these other people to us that we've been able to help.
And he has this thing where every time he sees just any outreach worker, he has to come up and give us a hug. And during COVID, since, we haven't been able to hug him, he's been like counting all the hugs he's missed. And he's like, I'm going to come collect. So we have that to look forward to when COVID's over. One last thing that did come to mind that was really, really interesting to me, and I don't think we would have been able to do without the RV, is that I found 2 women that I strongly believe to have had tumors. One was in Grant County who she was in her mid-30s and she thought she was pregnant. She'd had multiple pregnancy tests. I gave her one. Everything came back negative. She even went to the ER and they told her she wasn't pregnant, but you could very clearly feel a mass in her lower pelvic area, and it was movable, and it was just very, very strange. And she was having a lot of the telltale signs of uterine cancer. And so I had her go to a specialist, and unfortunately she never answered me. I never got word from her about what happened, which happens a lot. If I set people up with something and they get bad news, I think a lot of people just tend to shut it down and pretend that it's not happening. But at least we directed her to the right care, and she didn't go on expecting a baby for another 6 months until it was, hopefully it wasn't too late. And then I did see another lady on the RV, another young lady who had told me that she had had a lump in her breast for several years. And so I performed a breast exam on her, and it was very apparent that if she did not have stage 4 breast cancer, it was probably pretty close. Her entire breast was misshapen and lots of dimples and the kind of orange peel skin where the tumor kind of pulls the skin inward and makes it very wrinkly looking. It was a situation where, I immediately sent her to the ER, and she also did not contact me afterwards, which, I mean, it's heartbreaking because I would love to make sure that, these people are getting taken care of. And if they need any further liaison to the healthcare system, I want to make sure they're getting it. But I have to have faith that me sending them to the proper channels is enough, because it's more than they would have gotten otherwise. This young lady ignored a very clear breast mass for over 2 years, and it was serious. I would have almost been willing to bet my license that it was stage 4 breast cancer.
Morgan, clearly Welcome House is so blessed to have you on the front lines in that vehicle, because you bring such a gentle way about yourself, but such an educated, experienced way about yourself too. So thank you for your work and everything that you're doing. I wonder, Justin, I don't know how mobile you are right now, or if you can like pick up your device and kind of show us the space for those of us who haven't been in it.
I hope this doesn't make anybody motion sick. So this is the front of the RV where we kind of drive and keep storage and everything, but this is really kind of the epicenter. Maybe that's a good view. So like this, where I was sitting, is kind of our desk office area. And then this couch is where clients will kind of come in and we'll first meet with people, because right here is the front door. And then back here is Morgan's area. So we've got our exam table. I wonder if I can put this up. So this is where Morgan does all of her work in our exam room. And they've got these really great privacy partitions. So Morgan can kind of be seeing people back here doing exams, and people can be in the front and they can still have privacy. And then Morgan keeps all of her, medical stuff. I don't know what any of it is, but it's all in the cabinets, and we've got a lot of great.
That's another thing that we forgot to mention is we have capabilities to provide vision and hearing screenings, so that we can refer people to go get glasses. We can refer people who are in need of hearing aids to go get them, and yeah, it's pretty cool.
Yeah, and the really neat thing about it is right now I'm just on a generator. So the RV has like a built-in generator. So we have electric, we have internet, we have everything that we need anywhere that we are. Yeah.
That's really great. Thank you, Justin. I know that we have some people on the phone here who were part of the original focus area committee that reviewed your grant and were really excited about Welcome House receiving a grant. I just want to create some space and some quiet to make sure if people have any other questions they'd like to ask, we can get those out there. So anyone else want to ask a question? Okay, great. So Justin and Morgan, is there anything else you'd like to share as we wrap up the Welcome House presentation portion?
I think we covered a lot of it, just unless anyone else has any questions.
Stacy, do you have a question? Is that why you popped back up? Okay.
I mean, I think I would just share that, we're so thrilled to be like really a year into the vehicle. We've done more in that year than I really expected. And that's a credit to Morgan as well. But it's been really exciting, but we're still really growing and expanding. And I'm really excited to see what the next 3 years are going to look like. I mean, we're really trying to be able to do, even more testing than we've been able to do on the RV, even better connections to services and, flu shots and more flu clinics and stuff like that our people don't really get connected to, that we're really, really excited about.
Okay. We have a question. Are there specific partners you refer to for eyeglasses and hearing aids that are able to work with a lack of financial means? So hearing aids is actually one that I have been working on for the better part of 9 months, is finding somebody who will perform affordable hearing aids. There is a lady in Boone County who has a private practice who can give us, it's like a very basic pair of hearing aids for, I believe it's $1,200. And that's actually the cheapest I've been able to find. So unfortunately, those aren't cheap. It just so happens that Kentucky Medicaid is built in such a way that providers, audiologists are not required to provide hearing aids with Medicaid. And that makes it, that incentivizes providers to not want to do it, because if the Medicaid prices for hearing aids would be subsidized by people who are not Medicaid and would have to pay more, and then they would go to other places. So that's a big one that we're still working on. As far as eye care, Medicaid does offer free glasses. And so it's just a matter of finding places that allow or that give free vision testing, vision screenings with Medicaid, and then you can get the free pair of glasses under $100. Vision Works is one that I work with a lot because they are kind of a one-stop shop. You can go there and you can get everything done in one trip. That way, for people who don't have transportation, they're not having to walk everywhere, walk multiple places in a week. They can just go there, get their vision screening done, get their free pair of glasses, and then come back in 2 weeks to pick it up.
Question. Thanks for that answer, Morgan. There was a question that just came in regarding shifting of COVID-19 in the homelessness services system. So I know that congregate settings have been really hard due to social distancing. So what are the rules looking like in Kentucky right now in terms of what you're supposed to be doing, how you can best help people amid a global pandemic?
They change every day. So we try to keep an eye on it, and Morgan works really well with our medical director about some guidance. The CDC has put out specific and HUD regulations for homeless outreach providers. So we try to, stay up to date with that kind of stuff, where we're maintaining distance, we're all using PPE. We're doing a lot of that. We were hoteling a lot of people because a lot of the shelters shut down. So we had, I think, around 150 people in hotels for a couple months. We still have some people, but we've downsized that a lot now that some of the shelters are reopening. But yeah, it looks really different. We have a women and children's shelter. Our shelter is never shut down. We've kept operating in a congregate setting. Morgan is a big part of that, where we've been testing people in our shelter. We've been, really enforcing social distancing. So things look very different. And we haven't been able, we've almost been more focused on our really vulnerable population and less on kind of getting the RV out and doing our typical outreach right now. But we're reopening that up in like a week because the libraries are reopening. I don't know, Morgan, if you have anything.
Yeah, and our mission with the RV, where we've been taking it out and about, has changed a lot during COVID, if only because this population is so vulnerable that us going around and exposing ourselves and then exposing others to this virus would probably cause more harm than good. What Welcome House is trying to do is flatten the curve and to keep this population protected as much as possible, to educate on how to protect themselves, to provide resources so that people won't have to go to congregate settings. And in that way, make sure that if one person in that community gets it, it doesn't spread like wildfire. And then because another big concern with the homeless population and COVID-19 is that especially for anybody who's a nurse out there, that in a hospital setting, people who are experiencing homelessness are often overlooked. They're given, I don't want to say inferior care, but people often do not like to care for them. Doctors don't listen to them. It really just, they just aren't treated the way that they should be. And so my fear is that if we have a large population of people experiencing homelessness flooding into the hospitals because they can't breathe, that they're going to be overlooked and that they won't be given the same kind of care that other people will, and that they will not be prioritized. So we're really trying to prevent that from happening.
Yeah, and we really worked with St. Elizabeth too. So they've had people that have been hospitalized for COVID that are homeless, and we've worked with them to put those people in hotel rooms and isolate them instead of just releasing them back to the streets. So that's been really important for us too, is to figure out who's been positive and then make sure they're not just sent back out wandering the streets and infecting other people.
How can Impact 100 or members that are on the phone or guests that are on the phone right now, how can they help you? What are your immediate needs?
Morgan?
Supplies, money.
Really,
so many.
One of our biggest needs is tents and sleeping bags. Unfortunately, with most of the shelters being shut down, we have a lot more people that are sleeping outside than normal. So we are pretty in desperate need of tents and sleeping bags. We have, I think, a few sleeping bags and no tents. The other thing I would say is, really, we're very concerned about the next couple of months and really the next year. The eviction moratorium is being lifted shortly, and so we feel like we're going to see a real large increase in homelessness. So I think we're kind of trying to hold steady and see what our needs will be in the next few months.
And for anybody who has access to PPE, N95s and gowns for our providers, for our outreach providers that are going into people's homes essentially and are at a large risk would be very much appreciated. That's something that we've run low on, especially when we're testing so many people and we're coming into contact with so many people that are positive, and we can't throw away our PPE because we don't have PPE to replace it. We're just cleaning it and sanitizing it and doing our very best. So that's a big thing that would be on my wish list.
Great. Thank you for sharing that. Tents, PPEs, resources to help. That's really helpful. Thank you for explaining that. So I think we're going to kind of wrap up here. Thank you all for being involved. I think Sarah Grace has some parting words. Is your internet connection okay?
Yes. Well,
Okay.
on my phone. Yay. I just want to thank you so much, Morgan and Justin, for being here. I've learned so much. I've taken pages and pages of notes. I can't wait to share with more in depth with our members. And thank you to everybody who joined the call. And I just hope that you will join us for these anytime you have your lunch available on Thursdays from now until, Barb, what September something?
September something, yes, but I think it's ever changing, really
September something.
dependent really on what we can also do in person, I think, as time goes on. And also, I'd like Claire to just share very quickly the Step Up series, just so people are familiar with that.
Sure. So starting on Saturday morning, we have a series of 6 different walks around the region. They're from the book, The Steps of Cincinnati, and they're walks that are anywhere between 2 to 4.5 miles. We'll be walking with grant recipients on walks that are historically relevant to what the grant recipient does in our community. We'll learn about how they're impacting the community. We'll learn about some historical points along the walk. And we're doing this as a way to connect with Impact 100 members in a physically distant way, but also to invite guests to come along. As every nonprofit throughout the world is experiencing right now, we are anticipating this is going to be a really tough year for Impact 100 to recruit and bring people into our organization, just like I'm sure, Ashley, you're experiencing at your organization, and Justin and Morgan, you're thinking about at Welcome House. So we are trying to come up with things we are allowed to do for state regulations and things that we think will be missionally aligned and visionally aligned to help connect people with who we are and what we want to do in this community. No one person on this call can make a mobile unit happen alone. It takes all of us to pull that together, nonprofits, our members, pulling our resources. So we just hope that you'll join us either on a Step Up series or in Impact 100 and generally to be a part of our work. Thanks, Barb.
Yes, and just thank you all for joining our call. For those of you who are members, thank you. Certainly, we see important work that takes place and is being done based on the Impact $100. If you are not a member and wish to join, we would love to have you, whether at the $500 level or the $1,000 level. And, methods of payment range from, if you would like to pay monthly, that works, quarterly, or just one time, works as well. All we need is just to have your payment in by December 31st, and that's really it. So thank you for Justin and Morgan for letting us learn about you, what you're up to, and just the amazing work that you continue to do. So thank you so much for giving us your time and expertise. So thank you all. Enjoy the rest of your day.
Thank you. Bye.
Bye.
Bye.